My name is Damian Fogarty. I'm from Belfast, Northern Ireland. I'm a kidney specialist and nephrologist, and I'm delighted to be at the conference here looking at the future of pathology. So my main areas of interest in pathology relate to my clinical practice as a consultant nephrologist, dealing with patients and understanding what is causing their kidney disease, how is the kidney disease expressed in them, and how can we diagnose kidney disease better, quicker, more easily with patients. So the largest challenges to my practice of kidney medicine relate to the volume of patients that we deal with who have non-specific kidney disease and declining kidney function as they get older. And many of these patients develop significant kidney failure and require dialysis or kidney transplants. So understanding the cause of the disease in older patients with this nondescript form of disease is very important. So I think in the next few years, if we can dissect out the subgroups of those patients who have got this unspecified form of chronic kidney disease, that will really help us work out other better treatments we can offer them. So for instance, at present we can give general treatments with blood pressure therapy, but we have no specific agents to treat the progressive kidney disease that affects an increasing proportion. Up to 10% of the population have some form of chronic kidney disease. So that's the sort of overarching holy grail of where we would like pathology to take us in kidney medicine. Along the way, we've developed a lot of new diagnostic tools using serum markers of serum creatinine, and again this is a marker in pathology that could be developed further, particularly using a new marker called cystatin C, which is much more useful and more highly specific than serum creatinine. At the moment we have problems with overdiagnosing many patients based on serum creatinine, and there are some problems with its interpretation and use. So I think the serological improvements in pathology as it reflects or as it is expressed in patients with kidney disease will be important, and I think some of the tissue aspects of pathology, particularly in the non-specific forms of kidney disease, will be the next areas of growth and special interest in the next 5 to 10 years. Of course, within all of this, my big interest is linking together the data that comes from those patients with their clinical presentation, their progression, with other causes and consequences of kidney disease. So I think the big data that we keep hearing about in many fields will be very important in trying to map these novel pathological markers in the serum and novel tissue markers to understanding better how can we do more for our patients. I think on the horizon in the next 5 to 10 years, the area of pathology as it relates to kidney medicine will move towards more accurate diagnosis with more specific tests in both the tissue and serum, and based on those more accurate tests, a better subdivision of chronic kidney damage, more specific therapies geared towards that. For instance, already we have a number of exciting biological therapies that are being used in certain forms of cancer that actually can work quite well for some inflammatory proliferative types of kidney disease, and that clearly will develop further, and those agents are also very useful in transplantation as well. In the non-specific form of chronic kidney disease I mentioned, that is really a black box at the minute, and we need much further, a number of further advances before we'll be able to say, have we got new specific therapies for that area? But it looks exciting. And finally, the rare diseases that affect patients with kidney disease, such as polycystic kidney disease and some inherited disorders, are also being dissected every year. There's been advances in the last 10 years, and I think that more of those rare diseases will be dissected out. And I think particularly the tissue pathology aspects and the genetics will open that whole field up to new therapies. It'll be a very exciting time.